Hello, you're tuned into COVID-19 updates on The Wire. India is now the second worst hit country across the world in terms of total caseload. With over 90,000 cases reported for the first time, India has become the country to have recorded the highest daily increase in cases that no country has witnessed so far. The tally in India has now breached the 42 lakh mark. Of the 42 lakh cases, over 32 lakh patients have been discharged, with nearly 8.9 lakh infections are still active. The toll stands at over 71,000, with over 1,000 deaths being reported every day. An analysis in the Indian Express has shown that this trend of high daily increases can partly be explained by a corresponding increase in the number of tests being carried out. Here's a chart which shows that while India's testing capacity has increased steadily, the numbers have gone up sharply since August, more so in the last 2 weeks. At the start of August, between 4 and 5 lakh samples were being tested every day across the country. Towards the end of this month, however, the number has crossed the 1 million mark. Meanwhile, a look at data and trends of daily moving average on the Worldometer website for top 10 countries with highest caseloads also shows that India and Argentina are among countries whose increase in daily infections is increasing continuously, and the numbers are expected to grow much more. Meanwhile, Russia, Colombia, Mexico, South Africa are countries that have crossed over their first peak and their daily cases are now declining. At the same time, countries like Spain, Peru, and the United States seem to have crossed over their second peak as well. The trends of daily increase in this country are forming a M-shaped graph, except Brazil, which is not showing a clear decline or a clear increase in total cases yet. Increasingly, in two of our neighboring countries, Pakistan and Bangladesh, daily cases are declining sharply. In fact, Pakistan has shown a considerable V shaped decline and its numbers have gone back to its February levels. But this trend of Pakistan's daily cases remains quite contested. Experts in the country have pointed to abysmally low levels of testing, and a government official has told German media company Deutsche Welle on the condition of anonymity that he had direct orders from his superior to omit numbers by almost half. This month, he reported 34 new cases instead of the actual number of 63. Experts and some critics of the Pakistan government have termed this willful misreporting. Back home in India, in possibly the first case of COVID-19 reinfection in Bengaluru, a 27-year-old woman who recovered from the infection has contracted the virus again. This happened in a span of a month. The case has been confirmed at Fortis Hospital in Banirghata Road, and the patient was first discharged on the 24th of July. In Maharashtra, the state police force recorded the highest single-day spike in COVID-19 cases once again, with 511 police personnel and staff testing positive for the novel coronavirus in a single day. The police force also reported 7 deaths on the same day. The total number of reported COVID-19 cases among police personnel in the country has reached 16,000, while 173 people have died of the viral infection. In Delhi, as COVID cases start to rise again, the Delhi government is making preparations to ensure that there are enough beds for patients. Hotels, however, are not expected to be roped in this time. Banquet halls, too, will not be asked to hand over facilities for now. A government official told media, only if the number of cases rises suddenly will banquet halls be requisitioned. The last time making arrangements took some time as such an exercise was carried out for the first time. The Indian Express has learned that the Russian Research Institute, which developed the Sputnik V vaccine, has now submitted quote unquote comprehensive data on vaccines' safety and efficacy to the Indian authorities. Senior officials said that India had sought this information from the Moscow based research institute. Earlier this month, Sputnik V triggered a strong immune response in phase 1 and 2 trials on 76 people. The Indian Express's source told them that we are now deeply engaged with Russia on the vaccine front. As this data is being evaluated by experts in India, one option, according to sources, is that India may have a separate phase 3 clinical trial after necessary approvals from regulators within the country. In fact, according to official website of Sputnik V, Russia plans to conduct phase 3 trials in many countries including Saudi Arabia, UAE, Brazil and the Philippines. Meanwhile, in what could be called as the world's fastest and largest ever operation of its kind, UNICEF has announced that it will be leading the procurement and supply of coronavirus vaccines to ensure that all countries have safe, fast, and equitable access to initial doses of vaccine when they are available. UNICEF will also serve as procurement coordinator to support purchases by 80 higher income economies, which have expressed their intent to participate in the COVAX facility and would finance the vaccines from their own budgets. The Hunan seafood market in the Chinese city of Wuhan, believed by many to be the origin of COVID-19 pandemic, is sealed behind a blue perimeter fence and no foreign journalist is being allowed in the area. According to Reuters, after months long trauma of COVID 19, foreign journalists were invited on an official tour to report on Wuhan's efforts to rebuild the economy. Wuhan has reported no case of local transmission since April, but Wuhan was accused of acting too slowly in early stages of the outbreak amid fears of disrupting the economy or displeasing China's leadership in Beijing. Critics in the country say that media censorship and silencing of whistleblowers gave the virus more time to spread undetected. A senior fellow at the Council of Foreign Relations in Washington who studies the politics behind China's health issues, Yang Zhonghuang, said, "If you don't allow people to visit these places, you give people the impression you have something to hide." He adds, "There is no doubt that China has been very successful in containing the virus, so why can't they be more open? If you want to dispel those myths, you don't need to worry about people visiting the market area or even the virus institute." Chinese authorities closed the Hunan market in January, although some studies suggest that it was already in circulation by the time the virus reached the market. Reuters report also notes that China has shown little appetite for an international inquiry into the origins of COVID 19 or for allowing more scrutiny of its efforts in early stages of the outbreak. That's all for today. Thank you so much for tuning in. We will see you tomorrow. Until then, stay safe. Don't forget to hit the notification bell button to get more updates from The Wire.